everybody, and welcome to today's webinar. We are so excited to have you all with us with a topic that is very near and dear to all of our presenters' hearts today. Today, we're going to be talking about advocacy in motion, and this is all about how you can coordinate in-district advocacy events. My name is Sabrina McCarley, and I am chair of NARA's Government Affairs Committee. We also have Kelly Cooney, NARA's president, as well as Lisa Chambers and Kathleen Dwyer with us today, and they are both members of our NARA's Government Affairs Committee. So before we get started, we wanted to start with some of our housekeeping reminders, as these are very important. All attendees have been put on mute. The handouts for today's webinar were provided in the reminder email for the webinar that was sent out about an hour ago. If you have any questions for us as speakers, we ask that you submit them using the Q&A button on the attendee control panel. And for any technical questions, we ask that you submit them using the chat button on the attendee control panel, as Christy will be monitoring that. We also will be recording today's webinar, and it will be posted on the NARA members for the portal within about 24 hours. And we also like to have our disclaimer for everybody for today's webinar, and that is that the information shared on today's presentation is shared in good faith and general information purposes only, and it's accurate as of the date and time of this presentation. And with that, I'm going to turn it over to you, Kelly.
Thank you so much, Sabrina.
Oh, Kelly, I can't hear you. Sorry.
Okay. I'm unmuted. Can you all still not hear me?
That's better.
That's better.
Yep.
Change anything, but hopefully. All right. Well, my apologies, everybody. Technology. Well, I want to start today to talk about the heart of NARA and the advocacy that is at the heart of what we do every day. And NARA is here to advocate for the profession, but each and every one of you are a big part of that advocacy. And your legislators, what resonates with them is not necessarily the big stories that NARA has to tell about the industry. What resonates with them are the stories of what's happening in their district. And so what we want to do with this presentation today and with this movement to bring more legislators into our clinics, our centers, and our businesses is to share that local connection. And so, and really that is the heart of advocacy. That's the heart of what happens in government, is trying to tell those local stories to make an impact. So you're going to hear a lot of great things today about how to do that. And we're going to share in particular some specific strategies that you can take back to your business and take back to your district to successfully engage with these folks. We're going to have a lot of new folks as we enter in to politics this year and every year. So as we look at that, how do we engage some of those new folks? How do we engage some of our stalwarts? And how do we make sure that everyone knows the stories that you know about how decisions that are made in DC are impacting you and the beneficiaries you serve? So I will go ahead and hand back off.
Hey, everyone. So before we begin to get into some specifics, let's just talk about advocacy in general and how advocacy is defined. The dictionary defines it as the act or process of supporting a cause or proposal, the act or process of advocating. So you need to always remember you are the subject matter expert when it comes to your profession, your industry, but most of all, your patients. And their elected officials, they care about their constituents, which are your patients. And so any type of interaction, any type of education that you can give your elected officials to represent on the issues you want to be talking about that impact your patients, such as access to care and reimbursement challenges and other issues that may impact our patients. Can I advance? Okay. So as we go on this advocacy journey, there are three different types of advocacy. There's the self-advocacy, in which you are advocating, speaking for yourself on an issue that is important to you. There's also individual advocacy, in which a person or groups of people are advocating on the behalf of others, and they're focusing on interests of one or more individuals. Individual advocacy can be either informal or formal. And then there's system advocacy, which is focusing on change at the local, state, and national level. And this is important because this is to impact change within public policy. And so we want to make sure that we are like looking at all the different forms of advocacy. But most importantly, when you are out there advocating for your patients and your causes, you want to remember there's 6 principles of advocacy that you always need to keep in the back of your mind. You want to always be honest with what you're advocating for and about. You want to include fairness. You want to present your ideas and your asks in a fair way. You want to show respect for others and the position that they may have. And also, most importantly, you want to show compassion for others, that you can help. Are there ways that we can alleviate it? You want to advocate with integrity and always follow adherence to your values. And most importantly, use self-discipline in regulating yourself for your advocacy efforts. So with that, as you think about those different pieces of advocacy, the 6 principles, the 3 types, and kind of how you define advocacy, I'll turn it over to Sabrina to give you some specifics.
Thank you, Lisa. So now we're going to talk about something that is so exciting to me, and I feel so blessed to work for an organization that has really embraced this whole idea and this concept, and has really brought to light this coordinating in-district advocacy initiative. And from a transitional care management standpoint, I'm going to talk about some of the journey that we have gone on and with being successful in our in-district advocacy initiatives. And one of the things that I wanted to really put out there as we start this conversation is I asked Denise Norman, who's the president of Transitional Care Management, the question of why she felt it was important that we established what we call a TCM, so Transitional Care Management Government Relations Council. And this really was the foundational piece to get this journey started. And what she said is that when we visit the Hill every year with NARA, it really does amaze us how removed people are from what we do every day. But that makes sense. There's a lot that they have to keep track of, and they cannot know everything. And that we have to be the voice. And we all feel very strongly about that. We love impacting from a TCM standpoint, the change at a national level. We love everything that we do from an advocacy standpoint that NARA does. And we really see those results from everything that we do. And so she said that she thought, well, why not do this at the state and local level? That then we can raise awareness and we can overcome those obstacles that we face with that we're providing care for those that we serve. And also realized our crew members and our facility levels, they really wanted to be involved. And it's really hard for us logistically to bring everyone to DC. We would love it to bring out everyone to DC, but we can't. So we really developed and created this Government Relations Council to really have everyone be involved. And that includes our residents and our patients, really to showcase the services at our centers, the people that we served, and really highlight what we do at a local level. So let's talk a little bit about that journey. So first of all, we have to have a guide to coordinating in-district advocacy initiatives. This really can be one of those things that you really have to think about. Where do we start? How do we start? And so all of you are going to have a different journey in this conversation that you're going to have within your leadership teams. But we wanted to give you this guide really to help you in establishing this. So first of all, you've got to establish a lead person and a planning committee. So that lead person is really going to be your driving force in this. As an organization, you need to come together to define what your objectives are and to identify your key facilities, and then really come up with a plan of who and how do you locate your elected representatives, your senators, and Kathleen's going to walk you through that process in a little bit. So let's kind of break this down a little bit more. So when we talk about establishing a lead person and a planning committee, these are going to be the individuals that play a very active role in coordinating your in-district legislative events. So specifically, when we talk about this, we need to make sure that when you're establishing that lead person and the planning committee, next slide, please, we need to designate as an organization a lead person that's going to work in conjunction with your rehab teams as well as your customers and your leadership team. So this person really is going to be the central hub, if you want to think about it that way. They're going to help in organizing all of these individuals. There's a lot of players that come, a lot of logistics, and they're going to help in establishing what we call as a planning committee that's going to assist in planning the event, because this can't just all fall in one person. You've got to have that planning committee. Now, legislative visits should be scheduled at least 1 month in advance for a successful event. That's kind of just a guide. Sometimes it's longer than that. We'll talk through the fact that sometimes it'll take 3 months, sometimes it'll take 2 months, sometimes it's 2 weeks. So there's got to be some little bit of flexibility in that. And Kathleen's going to talk about a journey that Legacy went down with one of their visits as well. So if we think about this, we want you to just think about this as a guide perspective, thinking about a 1 month in advance, really just to think about this. So let's talk about defining your objectives. So this is a key piece. When we think about, first and foremost, you got to have a goal. So what that means is, just like when you go to DC and you advocate, you've got to have a goal when we're talking about what is the ask, because you have to know that ask when you contact your legislators to come to your buildings. So in that advocacy goal, you want to think about what issue or issues that you want to address. So you also need to have a level of understanding, is it a state issue versus a federal issue? Is this reimbursement, access to care? Is this healthcare policy? So think about, as a team, what is your messaging? What is that advocacy goal? And then we have, just so you all are aware, we wanted to highlight the NARA advocacy resources. So we've got a lot of resources that the Government Affairs Committee has created for you. And those are on our website, the Advocacy Center, under the Advocacy tab. And there's also legislative tracking under the Advocacy tab for the latest key legislative bills. So we've got a lot of resources to help you in this journey, so you're not alone. Then if you have a lobbying firm, so at Transitional Care Management, we do have a lobbying firm. And when I asked Denise about the why behind that, what she had said is that, just like in any business, we all have our areas of expertise, and we realized ours was not lobbying, that we needed a firm to help us get in front of the right people at the right time to make a difference. And we really have partnered very closely with our in-district legislative visits with our lobbying firm, really in helping us to determine what facilities, what key legislators do we need to focus on right now, and helping us schedule those visits. So they could be a great resource for you if you have them available. Also, look at your state associations. With your state associations, there are also resources like NARA has, where it can assist you in reviewing legislative priorities from that state perspective. When we talk about defining your objective as well, there has to be the facility type. So you've got to understand from a leadership team, are you going to be focusing on skilled nursing facility? Are you going to be focusing on hospitals? Is it going to be outpatient therapy clinics? Is it pediatric clinics? Is it rural versus urban? So really understand that piece. Again, if your organization does work with a lobbying firm, then you want to work with them to see, what facilities do you have? How does that match up with the legislators? What are their priorities? If you do not have a lobbying firm, the other thing, when we talk about how do you locate your legislators, you really want to map out your legislators to each one of your buildings. And then you want to take the time really to learn about each one of them, as Kathleen's going to talk about. This is going to be important, though. You've got to understand where your facilities are located, what types of facilities, and then the legislators that are in those districts. So that's going to be a key piece in your planning. So that takes us into the identifying of key facilities, because everyone needs to be in agreement, right? This isn't necessarily going to be one of those things that it's the most beautiful building, the newest building, the best state of the art and, rehab equipment. That could be something where we all get excited about and we say, oh, it's bright and shiny and we want to show that. But is that for that particular legislator or for that particular advocacy goal, is that the building that you want to showcase, that you want to bring them to? So this is where it's important that as a team in that planning committee, you all come together and really look at those key facilities and really understand from those key facilities, which ones are in alignment with your mission. So you want to choose facilities that align with your objective. So is it dementia care? Is it high managed care, high Medicaid, mental health facility, for example? Geography is really going to be important as well. If you want to select facilities in those key geographical locations, such as those perhaps in underserved populations or facilities with diverse residents, or those in urban versus rural areas. And you also want to look at what is that reputation or the impact. So you might want to consider facilities' reputation in the community, their community involvement, their 5-star rating. Just because, though, a facility might be a 2-star rating, it doesn't mean that you should just say, nope, that's not an appropriate building. You have to really, as a team, discuss truly everything about that facility and why we would choose that facility for a specific legislator for that visit. And this could be because maybe that particular facility, maybe they don't have a 5-star rating, but they have employees with a long tenure, or that they've got a dementia care unit that is really well respected. Or maybe it's a behavioral health facility that is something where there's not a lot in the area and you want to bring awareness to it. It really is important too, when you talk about this and you're looking at your facilities, that you also are looking at buildings where the why behind it. So for us, from a transitional care management standpoint, we really also looked at our buildings, and we encourage you to look at your facility teams and the leadership teams members involved in advocacy and think about the why. From us, when we evaluated the buildings, we really thought about ownership. And we've been using Lita Beam's book, Own It, as part of our leadership series. So we really thought about this in evaluating our teams is what better way to be able to demonstrate ownership than hosting our legislators within our buildings, at our centers. And I can tell you, we've seen such positive responses from the ownership of our team members in the buildings to our residents, our patients, the stories, the level of pride and ownership. It has been absolutely phenomenal. And we're going to talk more about that as well. So I'm going to turn it over to Kathleen to talk about how do you locate your elected official.
Thanks, Sabrina. Great lead in. All right, so let's go ahead to the next slide. And we're going to talk a little bit about congress.gov. If you're not familiar with this website, it is a great resource for you to go to find out all the latest details of the legislative bills that are kind of out there currently with the House and the Senate. And you can learn a lot about the legislation going to this website. However, if you follow this link, you can also get the information to who are the elected representatives in your area or in your facilities areas. So it's important that you have that zip code kind of handy. And as you enter into that zip code, next slide, you're going to see that there will be a list of individuals who are the members associated with that area. And they give you an option here to plug in your specific street address. So again, whether that's your home address or your facilities address, you then will be able to narrow it down to that representative from your individual district. So from there, what you want to do, go ahead, next slide, is click on the member's name. And once you do that, you're going to basically anything that you see in blue, obviously is a hyperlink for more information. But if you click on their name, it will take you to another page and you can learn more about them. You can learn about what legislation they've sponsored or co-sponsored, or really any activity that that person has had within legislation. You can also read their biography, which can be really helpful to learn a little bit more information about your legislator. So next slide. And okay, so you also can find a link to their website. And as it says here, we definitely see that each representative has a different website. They don't all flow the same. So it is important that you take a look at their website in preparation for meeting with them or their staffers. And if you're planning to have a visit with them, or if you're planning to invite them to your facility, this is an important piece, I feel, is to get to know them, right? Get to know who they are as a person, get to know what they represent from a legislative point of view, and that will help you to establish those goals that Sabrina talked about. Okay, so now we're going to talk about specifically scheduling a meeting with them. And we're referring to something outside of our meetings with them than when we have our Hill Day. So from their website, you will find, usually there is a direct link to schedule a meeting or to invite them to an event. It might be under a Contact Us tab, or you might just find a link that spells this out very specifically to invite them to an event. So before you start getting to this point of their website, you want to make sure you have a clear path. Again, your goal has been established. Are you inviting them to tour your facility, or are you inviting them to a scheduled event that the facility is hosting, or are you requesting a meeting in one of their local offices? So go ahead and get used to clicking on their website. If you go to the next slide, could be something like this. This one's actually quite clear. It has schedule a meeting, it has the contact. Some of the other ones that I've kind of looked through for preparing for today's webinar, you might have to dig around a little bit, but keep in mind that every one of them has the opportunity for you to schedule a meeting. Now, when you do schedule this meeting, we also need to know that we may not be meeting with the representative, the senator, and more than likely you'll be meeting with a staffer. So it's really important, and Sabrina mentioned this already, but I'll bring it back, that you know exactly what you want to talk about, because there's gonna be an opportunity here to key in some further information. And you want to give as much details to what you're looking for. That way they can pair you up with the right staffer. So next slide, another example here of what you'll see. So like it's highlighted here, you're going to, be specific here. You're from a healthcare facility, you're a healthcare provider, you're a therapist, and within some of the context of the text boxes here, you just want to be extremely detailed to your goals. What are you looking to talk about with them? Is it healthcare policy, the legislation that's currently out there? It might be something that you're going to be wanting to ask them for their support for a specific bill. And if that's the case, you want to have those details with you. So you can get those details at that congress.gov, look up each key individual bill, and make sure you have that number handy with you as you're sitting down with the legislator. I will say that most of these are going to ask you for some detailed information. So you might want to be prepared to answer questions like how many people will be involved in this event or meeting? Will there be media present in this event? So basically you're going to answer all their text boxes, and then once you click submit, you should be receiving a response back from their office in a few days. So just kind of targeting into a specific here. So Legacy Healthcare Services had the opportunity to invite an elected official to one of our facilities. So I'm going to talk you through how we did that. All right, so again, on their website, you're going to see that there's potentially invite me to speak or invite me to tour. Again, each website has some different language here. But again, on this ask, you want to be as specific as possible. So there was a group of us from NARA that were gathering in Tennessee. And so when that kind of planned event was occurring, we had an idea as Government Affairs Committee that perhaps we could invite them to tour a facility that was in that area that we were all gathering. And it was a great event because we were able to gather as a group of representatives from Legacy, from NARA, and invite the congressman who represents the area that one of our buildings is in. And I'm going to talk a little bit about that more specifically later. But on the website, what I did is I found the congressman's website and I keyed into inviting that person to come for a tour. And I really was as specific as possible on this invite. I included the fact that we were inviting them to tour a facility of senior constituents. I included that we were going to be speaking about healthcare policy and speaking directly about some of the legislative bills that are currently on the platforms here that are potentially that we need to get passed that haven't been passed yet. So I included all of those details in that invite. And I actually specifically asked if Dr. Green could attend because he is a physician, and I thought that that would be a really good connection from a healthcare policy standpoint. But I also did include in my ask that, of course, we would be more than happy to have the opportunity to speak with staffers. So I was very clear in the ask for who was going to be present at that event, how many people to expect. And I was very clear that we were hoping to meet with the representative of the Congress because he was a physician, and I was also welcoming in the opportunity to meet with staffers if not available. So again, when you're preparing for either inviting them to tour or to an event or have a meeting with them, the most important aspect is being prepared. All right, so with that, I'll hand it over to Sabrina.
Thank you, Kathleen. And each one is very different. So I want to emphasize that you might even think you got down this process and you got the invite and your messaging clear, and then they could call you or email you or say, hey, try again. So one of the things that I also want to say is we're utilizing this as a 1-month planning guide. And this is something why it is so important that you have a leadership team come together in a planning committee, because things happen, right? We had buildings that had a COVID outbreak, right? You can't change that. That happens. We had a representative that had a death in their family. So everybody's got to be adaptable, and you could have everything set and everything's ready to go. And that morning, there's just a change of plans. So that is the one thing about politics that we are all aware of, and meeting with legislators and their staffers, things change. And so we do our very best, and we put our best foot forward, and we plan it out as best as we can. But we also know that we might have to, change plans. So let's look at this from a 1-month planning guide. And again, depending on your facility, depending on your organization, you might want to take this to a 2-month planning guide or a 3-month planning guide. And all of you will know that within each one of your organizations, what is going to fit best for you. And even though we have broken this down into a 1-month training guide, we want to emphasize that we've kind of broken it out per week. But you could easily, this week 1, the initial planning and contact piece, this could be 1 to 3 weeks. This could be 1 to 4 weeks. And you can break these down even into subcategories, right? Because our task analysis as therapists, right? Break it down even more. So this is just a guide that we really hope to get you all started. So first and foremost, when you're talking about your planning and your initial contact, you need to identify that everything that Kathleen was talking about. You need to identify who's the elected official. So you've got to do your research, as Kathleen talked about, and you want to look at who are those that have influence over healthcare or senior care, skilled nursing, hospital, for example. You want to look at, is this something, are you going to be more focused on in that specific geographical area? Is this going to be a state representative, or is this going to be a federal senator or congressman, right? There is a variety that comes into play, because when we talk about advocacy at home in the district, this isn't just at a federal level, it's also at the state level. And your constituents and your patients, your residents, your customers, your employees, your crew members, I know we have 1,000 different names for all of these individuals. They are all constituents, and that's really what's important. It comes to, at the end of the day, about bringing awareness and highlighting the services that you provide. And so this is that opportunity truly to shine and to highlight that. So make sure that you are doing all that identification that Kathleen talked about. And then the second part, once you've identified, preparing those materials for contacting them. So this is where Kathleen was saying, and we can't stress this enough, you have to very clearly know what your messaging is. You don't want to put yourself in a situation where you're contacting an elected official and you just kind of freeze because you're not quite sure. You just thought it would be a great idea to invite Congressman Thompson to your facility on Tuesday, and you didn't go much further than that. You really have to think this through, and that's why, don't limit yourself to 1 month if you need longer. This is something where there's got to be an investment from your leadership team. There's got to be an investment from your customer, from your rehab team. There's a lot of individuals involved in this. So make sure that you are very clear in your messaging when you're asking. The other thing is that we highly encourage, and this was a great learning experience for us at Transitional Care Management, was developing fact sheets for each one of the buildings where we had legislative visits. And this was about gathering data. What was the average length of stay? What are some of our outcomes? What are those top diagnoses? And then also getting the residents involved and getting success stories. Why did they love being there in that building? Or someone who recently was able to have a successful discharge, getting their voice. And that's that personal connection that Kelly was talking about. Those stories are golden. And so you really want to make sure that their constituents, your residents and your patients there. So really looking at consistency too about your fact sheets. The representatives' websites, they could all be different, but in your own organization, if you could have a nice flow and a template that you're going to use for all of your visits, that will really make it easy for everyone who's doing these visits and talking about them. So really bringing light to even highlighting if you have a building where, your rehab team has been there average of 20 years, highlight that. If you've got a building where your turnover is very, very low, highlight that. That is super successful. This is one of those opportunities, really share those successes. Or at the other end, if you have a building where you're really struggling with staffing, it is okay to be transparent. You want to be honest. This is that opportunity to highlight and to share your stories. And perhaps that is why you're utilizing telehealth, and it can lead to that conversation. So really just understand all of those facts, all of those dynamics within the building ahead of time. When you contact the official's office, as Kathleen had mentioned, you're going to go into this with a date and a time, but you also need to be a little bit flexible. And I really want to highlight and stress that piece. There are times, the story that Kathleen shared, and she's going to talk about it more, we had one date. We were very limited to our availability. At the time, we were flexible, but we really had only one date where we were all available for this facility visit. And you can share that, that we have, limited availability of individuals who are available. And that's okay to be transparent and open with that information. But also what I would recommend is come to the table, come to that discussion, that request, give them 2 or 3 different date options. And when you look at those date options and the time, I also recommend that you work with your customers. You work with the rehab team as well as with the customer from, if you choose 11 a.m. and that's when the facility is serving lunch, is that really the best time? Probably not. Right? So you've got to be collaborative and have this open communication as to we use 2 times a day. We use 10:30 a.m. and 2 p.m. That was in between meals. It was after activities. There's a lot going on. It really was the best time that worked for each one of our centers for all of the departments. So provide 2 different time options and provide several different date options. Then, as Kathleen had mentioned, if you're going to have media present or you're going to be taking pictures, there's oftentimes that conversation. They are very happy to take pictures and to highlight that they came and they saw their constituents. Again, I cannot stress enough the need to be coordinating with facility leadership. We don't want, if you're a contract rehab provider, we don't want you to just go to the facility and say, hey, guess what? It's Wednesday and on Friday we have, Congressman Thompson coming at 10:30 in the morning. You don't want to catch them off guard, right? This is something that they want to take pride in as well. And then you're going to want to have that conversation as to who's going to be potential speakers, who's going to be giving the tour. You don't want to be in a situation where all of a sudden an IDT team of 20 thinks like, this is great. All 20 of us are going to go on this tour and you're going to have this one legislator, because that's a little much too. So you want to make sure that you're really fitting it into the dynamics of the facility. So let's talk about the next piece of this. So that's really all week 1. When we move into week 2 here. So week 2 is really about that follow-up and your detailed preparation. So now you're starting to get into the details of this. So this also isn't a one and done. When you're building relationships with elected officials in their offices, as Kathleen said, you do that initial request. If you haven't heard back in a week, there's a lot going on. Maybe you contacted them during the middle of the election. That's going to kind of throw things off. Maybe there's some big votes going on. Maybe they were out of office. So there's dynamics within that. So always give them a week. Know that sometimes they're faster than that. Sometimes it's 7 days, sometimes it's 10 days. So you've got to be flexible, but give them about a week. And then you want to follow up at their office just to confirm any interest, see if they had any additional questions. Sometimes what I am seeing more often, and I even had a conversation this morning with my congressman's office, is they wanted to verify multiple times that I was a constituent. For an office that I talk to a lot, they wanted to check the spelling of my name. They wanted to check my email address, and I needed to verify my address to have a conversation. So don't be put off by the fact that some of the offices are asking more specific information about who are you? Are you a constituent? And then what is the ask or the follow-up with that? And so that's an important piece. So you might be asked, as Kathleen had mentioned, who is going to be there, where you're going to have to provide what their role is and their names. And they could say, thank you for your interest, but we're limiting this to 4 participants. And please don't be offended by that. That is just the way the office works. And there's not a one size fits all. I wish we had a magic solution to this and we could say every office will do X, Y, and Z, but they're not. So we just want to make sure that we're being fully transparent with all of you in this process. Now, when we're talking about week 2 and you're talking about a 1-month plan, you want to think about, if this is 1 month, 2 month, 3 month, about halfway through. So the end of the second week, if we're doing 4 weeks, you want to solidify that date. So you want to really try to get them to confirm a date and a time so that you're not all rushing with that. So about halfway through your planning process. And then you want to have some internal planning meetings with this. So you want to host a meeting with the facility staff to go over details of their visit. You want to determine key points in the communication with their officials. So funding challenges, your patient outcomes, workforce shortage, whatever it is within that facility. And you want to know who's going to be involved in that initial conversation as well with the facility. We did an Advocacy 101 with our teams, really to make sure everyone had the same level of understanding of advocacy and of their elected officials. And we encouraged all of our team members that they actually went to the legislators, to their website, and they signed up for their mailing list, just so that way they could get familiar with the process that Kathleen was talking about. You also want to have draft talking points at that point for the facility's leadership team, for the staff, and identify specific residents or family members who might want to share their experiences. This is one of those things that you want to think about, and you want to be, planning in advance. If there's going to be any pictures, you want to make sure you have the appropriate consents. If there are patient rooms that you really want to highlight, or a patient room or a family member where they just have the best story to tell, you want to be preparing that ahead of time. And what's also going to be key here halfway through this process is really preparing an agenda. It is so important that you have an agenda clearly set out, that you're ensuring you have ample time for introductions, a tour of the facility, discussion with the staff and residents, debriefing the session, and including any Q&A where the elected official can actually ask questions about facility services, challenges, etc. That takes us into week 3. And in week 3, this is where you're in your final home structure. These are the final preparations. You're going to confirm facility visit details. You're going to confirm the date, the time, the agenda with the elected official's office. You're going to make sure they're aware of any potential, if there's media, or if you want some photo ops. You're going to finalize any internal scheduling and notify all key participants. This is a great time too if you want to do a dry run. We had certain members of our leadership team. They went, put on a suit. One of them put on a suit, put on a name badge, said, that she was a senator, and said, give me your tour. Does the facility present well? Is it clean? Did we declutter? Are they comfortable with their talking points, etc.? So you want to make sure that all of your material is also available. If you're having media, you have that coordinated, or if you have someone on your own team who does social media, have that person. But that dry run is great. And it really helps people. If you want to think about your first legislative visit, people are always nervous. And Kelly and I say this all the time when we take individuals with us. People are nervous, but at the end of the day, they're just like you and I, right? And this is their job. But having that ability to do a dry run and get practice and familiarity is really key. So then now we're in week 4. So week 4 is this visit. This is the visit This is the follow-up, right? This is it. This is what we've been preparing for at least a month, right? Your teams are excited. You got all your materials. So that day of the visit, make sure that your team that's going to be there to help support, that they come early. Understand that elected officials sometimes come right at that minute. Sometimes they're a couple minutes early. The way we've been doing it and what I advise is, whoever's going to be taking part of that tour, that you're there at least 30 to 60 minutes beforehand, making sure, everything's in the right place, that, if there's any help that's needed, setting up or helping, if there's breakfast is still out, those little details, making sure you're helping the facility and partnering, being team ready and being tour ready. Then making sure that day of the visit, that receptionist also knows who to expect, right? You don't want to have the receptionist who says, sorry, no visitors to your elected official, because they weren't aware, right? So you want to make sure that they understand, we also showed pictures to our receptionists of who was coming that we knew, just so that they were aware as well. And our receptionist took a lot of pride in the fact that they were that first point of contact. So that's a very big deal. So we made sure they were equally involved in this process as well. You want to make sure you're following that planned agenda, but that you're flexible, that there's spontaneous questions, interactions. You'll have residents coming up, staff members coming up. It is a facility. If it's outpatient, peds, skilled nurse, we're still in operation. After the visit, you want to make sure that also at the visit, take a photo op. That's really important. Highlight that, share it on social media. Your post follow-up, it is so important, and I cannot stress this enough. Send a thank you note or an email to the elected official and their staff, and make sure you do that within 24 to 48 hours. Express appreciation, do a summary of what you talked about, share the pictures and say, thank you so much. I wanted to share the picture that we took during your visit today. If you have any questions, these are the contact people. I'm happy to help. And then you want to have an internal debrief. This is important. Those that participated in this, they take such pride, and this is such a pride moment that you don't want to, just as a leadership team, run out that door. You want to take that moment, gather everybody up, get their perception, let them talk about their experience. And it really warmed our heart to hear how appreciative they were and how much they loved it, and just the stories. So that is something you really want to make sure. And then if there's any follow-up. So let's talk about the legislative visit, our tour guide. So this is part of that agenda. So you want to designate a lead for giving the tour. You don't want it to be the legislators there and you're like, oh, Kathleen, are you doing it? Or Kelly, you're doing it. Know ahead of time, right? So we want to the best of our ability, have a plan, right? Be very solid. So is it going to be the administrator, facility director of nursing, who's it going to be? Determine for who from the facility or even your own organization who's going to be a part of the facility tour. Just because someone's not part of the facility tour doesn't mean they can't be part of the debrief after. So that's an important piece too. Not everyone's going to get to go on the tour. You want to determine your facility tour path. This is key. Don't go into this blind, right? You want to make sure you're only going to go down the east wing, housekeeping clean the east wing. Everybody knows on the east wing, right? To the best of your ability, but be flexible. You might have to go down the west wing, right? Things happen, but know those things. And you want to designate a location in the facility to meet with the elected official after the tour. This is going to be key. I really love this opportunity, and I highly encourage you to have this, because this is that opportunity that now you've introduced, you've given them the tour, but now you get to really have that one-on-one interaction with them to really say, okay, this is what you saw, but this is why the reimbursement is impacting. This is the impact it's having, right? You can really start to connect and ask them questions or thank them for legislation that they have sponsored in the past. You also want to then make sure that you have someone to capture the moment. Pictures are great. We're going to show you some. Ensure all facility staff are aware of the scheduled visit. You also want to make sure activities are really key in this, that there's a lot of activities going on. We had one visit where the legislator said, well, I really want to go on this tour, but they're having so much fun. I would love to go participate in that activity. So is that going to still be going on, right? And we had residents, you've got to let them know, because they were saying, well, I want to meet my elected official, right? I'm a voting member, right? So there's pride in all of this. That's so important. So we're wanting to also give you a script. So this script is of a first SNF facility legislative visit, but you can adopt this to anyone. We want to do an introduction. Introductions are fast. They're 5 to 10 minutes. This is done by the leader, really, just going through good morning or afternoon. You want to make sure you're addressing them, representative, senator, council member. by their last name, letting them know that you're so grateful that they took the time to be at the facility, highlight the facility name, who they are, what their title is, and then let them know that they're going to be the guide for the facility and introducing them to some of the residents, the staff, and then also highlighting that that they have a busy schedule, but that you're so appreciative they're being there and the credible work that they're done. The purpose of the visit. So this is one of those times in that you would say, as you know, skilled nursing facilities like ours provide vital care to some of the most vulnerable members of your community, seniors, those with chronic illnesses. You can talk about your mission. You can modify this. This is just a guide. Your facility overview will be, again, done by your leader. That'll be about 5 minutes, and giving that background, the facts that we talked about, those key statistics, and then the local impact. And this is key. So we're not just a care provider, but we're also an important part of the local economy. How many people do you employ? That's an important piece. You want to make sure that you're bringing it back to the fact that these are the constituents, right? The individuals who live there, the individuals who you employ. From the tour, in the next slide, we'll talk about the tour and resident interactions. It's going to be about 15 to 20 minutes. And this is going to be done while you're walking through. So let me take you on a brief tour. We'll also stop by some areas to meet some of our staff, know in advance. You want to focus on main areas, common space, therapy rooms, if you have any specialized care wings, etc. Talking points, you want to make sure when you're talking about physical therapy, occupational therapy, the rehab room, speech therapist, what do they do? This is your opportunity to say, if you've got a PT in the room, what does physical therapy do? If you've got an occupational therapy practitioner, what is it that they do? If you have a speech language pathologist, take that opportunity. And then if there's any residents that you would like them to interact with, that is the time as well. On the next slide, this will be the discussion of those key issues and challenges. And this will be about 15 to 20 minutes. So again, the leader is really the leader of this. They're the ones who's taking charge. After the tour, this is going to be during that sit down. And this is where you start that off again with that thank you. Thank you for taking the time to talk with us, to meet with us. We want to talk about broader challenges that we face at the skilled nursing facility, especially within, what is the state, the county, the city, et cetera, and how policies to provide high quality care. So maybe it's staffing shortages, and you're going to talk about that. Maybe it's reimbursement rates. Maybe it's regulatory burden. But take the time to really kind of go through, but have, to Kelly's point, stories that relate to that specific facility. So that way, when they go back, then what they're going to say is they're saying, oh, I remember when I went to Joliet Terrace, they specifically said X. And now you've really built that connectiveness, that stickiness, I like to say, with that representative. And they have a real life example when a scenario comes to them. So on the next slide, we're going to talk about those closing remarks. And closing remarks are kind of just putting it all together, right? This is the bow on the package. This is about 5 minutes. And again, the leader is going to really start with a sentence. Before we wrap up, I just want to say, again, how much we appreciate you coming today. We hope that this has been a clear picture of the vital work that we do here, challenges that we face, and also say things such as, we truly believe with your support, we can continue to provide excellent care for our residents, ensure facilities like ours remain a key part of the healthcare system for seniors, our most vulnerable populations. And then you also want to add to that the next step, right? So you want to start closing that gap in this. So you want to say things such as, we'd love to stay in touch and continue the conversation. We'd love to have you back in our building. Kathleen said, invite them to an event at the building. So maybe you're doing a harvest fair. Invite them to that harvest fair. Don't just let this be a one and done. We want to make sure that they know we are a point of contact. Have those business cards and say, we are here for you. We'd love to have you back. And when you're having community events that are open to family, invite their office. They may not come. Maybe they'll send a staffer. Maybe they'll do a quick stop by. But it's important to continue to build that relationship. And then again, with that, thank you. Thank you again for having the time in your busy schedule. And then the next piece is capturing the moment. So take that picture. Share it on social media. This is important, right? You want to tag your member that was there. You want to thank them, say what we talked about. You want to tag your company, your customer's company, tag NARA. We will retweet that. We will reshare it on LinkedIn. This is an opportunity, right? So what we did is we provided you NARA's Twitter, also our LinkedIn. And then the next slide shows a couple of pictures where we talk about capturing the moment. This was one of our buildings, and these were just some of the interactions that occurred. And our activities director, he was so excited in this, and they were talking about our staff, and what they were doing, and she loved the activities, and it kept leading to greater conversations. And so one of the things too is, it just so happened we were really grateful to be able to highlight that we also, the building was a great place to work certified. So it was perfect timing. She was very appreciative of being able to share in this moment with the staff. The staff were very happy about it as well. And then on the next slide, I just wanted to share before I turn it over to Kathleen is one of our building's administrators that you saw in the previous picture in the black skirt. She kept saying, you know, I'm very nervous. I don't know what to say. And we kept reassuring her, you know what you say. You've been doing this a long time. This is your building. She took such pride in her building. And she just had such pride at the end of this. And so we asked her really to share her experience in a couple of words. And what she said was Joliet Terrace was fortunate to have hosted a visit from Senator Rachel Ventura on August 28th. Both the staff and residents were delighted to have met her and provide her with a tour of our facility. Over refreshments, we were able to have an honest conversation with the senator discussing various policies that would benefit residents living in long-term behavioral health centers, as well as concerns with reimbursements for the services rendered. The senator was gracious and answered our questions and concerns with conviction. Joliet Terrace looks forward to many more visits from members of the legislature and hope that their voices will carry through the lawmakers to improve the lives of our residents. And that's from one of our administrators. And she was just so excited. And we have another visit scheduled that they want to keep doing more. And the residents at this building, they were so excited. They were part of this, right? It wasn't just the staff. The residents were, you know, cleaning tables after breakfast. They were like, we're going to be ready. We want to highlight, this is where we live. We are so happy to live here. We're so proud to live here. And just the joy and being able to show that off. So with that, I'm going to turn it over to Kathleen to share a little bit more about the visit that she touched upon.
Thanks, Sabrina. Yeah, great story, and I'll piggyback there. So as you see here in this picture, we have our CEO, Jeff Ryan. You might recognize the next two individuals, Sabrina and Kelly, representing NARA. And then that is one of the staffers from Dr. Green's office, Dr. Green himself, and then two of our staff who hosted at Charter Senior Living, which is in Franklin, Tennessee. So again, we had a fantastic day celebrating, you know, what great things we do for the constituents that live at Charter Senior Living. And that was really our focus with them, is making sure that they hear the stories, just like Sabrina said, you know, letting those residents have a chance to speak with them, letting them give the feedback to how important therapy is. That just helps to allow Dr. Green and his staffer to see the lens, right, that how important therapy is and how impactful we are to their quality of life. So definitely a key element there. I do want to just share with you that, you know, when we began this conversation to have this meeting, I did reach out to Jeff to, you know, first of all, seek his permission to move forward with this tour and to, of course, let him know that this was, you know, the idea that we had. And when I did this, the first thing he said to me was, I'll be there. Now, Jeff does not live in Tennessee. So this meant he was getting on an airplane to fly there and to be a part of this day, took a day out of his very busy schedule as a CEO. And he did that as a very natural moment. You know, that it was his reaction. He absolutely wanted to be there. So you know, I shared some discussions with him after the event, you know, how it went, and he is definitely dedicated to advocacy. And I think that that's a huge blessing here, of course. And he wants us as leaders to be talking the talk, because if we don't, you know, can't talk the talk, then you don't walk the walk. So he encourages us to lead by example and to make extra effort to be communicating to our legislators, making sure that they know what's happening here in the real world of therapy and how, for example, the therapy cuts are impacting us, you know, year after year, but not only how they're impacting us, but certainly how they're impacting the senior constituents that we all serve. So again, he shared his experiences with me. And one of the things that I absolutely loved hearing, and it really does speak to Sabrina's feedback as well, but, you know, he said his favorite part was listening to, this is an assisted living, so it's the executive director talk to Dr. Green and his staffer about us, the therapists, about the services that we deliver, about the quality of life that we're improving. Now, I don't know if that administrator or executive director is a constituent, but there's a probability not only that she could be, but also that she's serving hundreds of constituents at this facility. And she's giving direct feedback to how those constituents are, benefiting from our services. So in my opinion, this is really the best aspect that we have, to have our legislators in our facilities, to allow them to hear directly from their constituents the value that we provide to not only the constituents in that facility, but certainly the community around. So it was just a fantastic experience, and I'm really glad we had the opportunity to meet with him and his staffer. And what was awesome was when I was able to follow up with him at the spring conference and say thank you so much for touring our facility. So that is just one of the stories here that we wanted to share with you. So we'll conclude here with just speaking to the most important thing after you have the opportunity to sit down with your legislator, whether that be in their office, in your facility, at an event, is to write a thank you note. And as Sabrina already talked about, this has to be done, kind of soon. So within 24 hours of meeting with them, send this thank you note, be specific. Say thank you, of course, and, give your appreciation for their time. But I think that this is also our opportunity to reinforce all of those key elements that we discussed during the visit. So I would include in this email any kind of literature or references, studies, the exact number to those bills that you're asking for their support. Be extremely clear here, because this is your last opportunity to just highlight again our issues, where the ask is to them. So take this as that opportunity, say exactly what you need their support on, be brief, be straightforward, and also be sure to provide your contact information. Recently we did another visit here in Ohio, and we actually said, as in our last line of the thank you note, is we're here to help. So if you need any help, reach out, because we're willing to put the time in anything that would improve healthcare policy, healthcare legislation. So in conclusion, we truly do have louder voices when we advocate together. This concludes our presentation today. I thank you very much for your time.